So my name is Adnan Elhammali. I'm a radiation oncologist with Northeast Georgia Physicians Group. I primarily work in our Braselton office. I grew up in the Metro Atlanta area. I went to Georgia Tech for my undergraduate degree. For medical school, I went in St. Louis, Missouri at Washington University School of Medicine. And then to become a radiation oncologist, you have to do 5 years of training after medical school. So I did that at MD Anderson Cancer Center in Houston, Texas. And after completion of residency, I was very fortunate to have the opportunity to come back to where I grew up and care for patients locally in the Northeast Georgia and Metro Atlanta area. So I became fascinated with biomedical sciences when I was an undergrad student. Modern medicine is quite phenomenal, and the treatment options that we have nowadays to treat patients, improve quality of life, and minimize toxicity was really, really fascinating to me. And it's a constantly evolving field. Treatments are getting better. So I was just fascinated by the science of it, and to be able to utilize that science to help people live better and healthier lives really drew me to medicine. So we are a radiation oncology service, so we take care of primarily patients with cancer diagnoses. Patients with cancer are often treated with surgery, medicines, systemic therapy, or radiation therapy. So approximately 60% of patients end up receiving radiation therapy as a part of their treatment course. And so I'm a doctor that specializes in the treatment of cancer with radiation therapy. So oftentimes when patients come to see me, they're obviously very scared with their cancer diagnosis. Most patients are very scared about radiation therapy. And patients have to make complicated treatment decisions. And part of that is having a good understanding of what the treatment options are. And so, my job and my duty is to, break down, the science and the rationale for our treatments into simple terms that non-medical, patients can understand. And so my belief is that all my patients should have a clear and basic understanding of the reasons for our treatment recommendations, what their expected benefit and side effects are, and they should really feel empowered to ask questions and to make a decision that's in line with their goals of care. So patient education is a huge focus of mine, and I really enjoy that component of care. Northeast Georgia Physicians Group and Northeast Georgia Health System is a large health system. They're a broad spectrum of doctors. They're primary care doctors, and they're doctors that are disease specialists in multiple different disease subsets. One of the prides of working in this health system is that we offer patients the latest and greatest and most advanced radiation therapy treatment options close to their homes and within their communities. When our patients come to us for treatment, they can feel confident that they're being treated according to national and international standards of care, that they're getting the greatest treatment. Modern radiation therapy has come a long way. It's much more focused and targeted than it ever was. Our ability to treat cancer anywhere in the body is much more precise than it was even a decade ago. And it's really a great thing for our patients to be able to receive the latest and greatest treatments within their communities, not having to leave their homes and disrupt their lives to get their treatments.